I don't know if Natalie saw the show that we ran a few days ago, but one of the things that came out of that show was that GPs, being as busy as they are, they quite like to be told what it is you want them to do rather than asked for an opinion. And maybe it's helpful to say, these are the factors that I'm taking into account. This is what I would need to screen this person with possible view to referral. And please, would they do that? Can I assume that X-ray is your initial first screening tool?
Always. I think X-ray, when it's properly interpreted, gives you an absolute wealth of information, either in, obviously in arthritis, it just gives you the answer straight away. But, in non-arthritic hip disease, it also gives you an awful lot of information. The slight problem you might have with that is particularly when you get X-rays referred from primary care, you may then not get them seen by either an orthopaedic surgeon or a musculoskeletal radiologist who's got sufficient experience to pick up some of the subtler problems. And they often, for example, mild dysplasia might get reported as normal. And so again, that can be one of the slight bottlenecks in the system that, it's difficult to know how to overcome that. But I think, it's definitely there. I would certainly agree that, it seems to be, a move, or was a move certainly, to go via MRI as your first investigation. But whilst MRI is very helpful, it almost always shows up labral tears and things like that. It's not really the labral tear that interests us, it's the mechanism behind it. And the MRI in its current form does not really provide much structural information to kind of hang your hat on in terms of the biomechanics.
Okay. How difficult would it be for a physical therapist to gain enough knowledge to be able to look at an X-ray and just form an opinion about those mild dysplasias you were talking about? I'm not suggesting we can become radiologists overnight, of course. But
no, I don't think. A bit like when we discussed this with orthopaedic trainees, who will obviously be seeing a lot of patients through clinic, but may not have, again, lots of experience. It's not very difficult to point out a couple of, particularly obvious areas that you can measure on an X-ray that will give you a broadly speaking, an idea about where they fit in the categories. And that will pick up a lot of things. Will pick up a lot of the milder pathology that you miss if you don't look specifically for it. Yeah. And again, we also encourage people, my hip colleagues who don't treat the disorders and so on, to obviously, engage in understanding of them. But also, if they are not seeing something and the patient is still in pain, to remember that hip pain in young patients is not a normal phenomenon, and it should always be investigated if it proves recalcitrant.